in response to local efforts to reduce the spread of COVID-19. Before we start, I wanted to thank everybody for being here, for participating and for watching, and for helping us practice good, safe habits to help spread the virus. I am consistently seeing people doing the right thing, and for that, I really want to say thank you. We're going to start again with City Manager Lauder, who will provide us an overview on how this meeting will work and how we'll proceed, and then we'll get on with business. So, City Manager Lauder.
You have to unmute.
Thank you. Still getting the hang of this. Thank you, Heidi. Thank you, Madam Mayor, members of the council, staff, and viewing public. Just a few teleconferencing tips before we start. First and foremost, or most importantly, if you're not actively speaking, please mute your microphone. That will help reduce the ambient noise and allow everyone to be able to hear each other completely. And I really can't emphasize that enough. And also don't forget to turn on your microphone, as I just did, because then we can't hear you either. All council comments or questions will be taken by a roll call through the mayor. Third, all votes will be taken through a roll call vote. Please answer yes or no when your name is called by the city clerk. And lastly, public comment was accepted via email and in writing and phone messages for agenda items until 4 p.m. today. Comments on agenda items were forwarded to the council. If you called or emailed requesting that you would like to speak during public comment or on a specific item, please be ready to comment when you are called. Madam Mayor, back to you. Madam Mayor, unmute, please. Thank you.
It's like I didn't listen to you. May we have roll call, please?
Mayor Seaman?
Here.
Councilmember Castellano?
Here.
Councilmember Messner?
Here.
Councilmember Allison?
Present.
Councilmember Arroyo?
Here.
And Councilmember Burgell?
All right. So now that we have done roll call, we are going to do the Pledge of Allegiance because it's in our agenda. So I happen to have a flag here in my office. What I'm going to do is I'm going to turn my computer to the flag. And if you wouldn't mind joining me, I'm going to stand up beside my computer and say the pledge. You all could see the fine flag. I pledge allegiance to the flag
Of America, to the republic
For which it
for which it
stands,
stands,
one
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
with liberty.
liberty and
and
justice
justice for all.
Thank you all very much for that. And now we will move on to mayor's announcements. I have two announcements tonight, proclamations, and those are, the first one will be for National Public Safety Telecommunications Week. Whereas emergencies can occur at any time that require police, fire, or emergency medical services, and whereas when an emergency occurs, the prompt response of police officers, firefighters, and paramedics is critical to the protection of life and the preservation of property. And whereas the safety of our police officers and firefighters is dependent on the quality and accuracy of information obtained from citizens who telephone the Eureka Public Safety Communications Center. And whereas public safety dispatchers are the first and most critical contact our citizens have with emergency services. And whereas public safety dispatchers are the single vital link for our police officers and firefighters by monitoring their activities by radio, providing them information, and ensuring their safety. And whereas public safety dispatchers of the Eureka Public Safety Communications Center have contributed substantially to the apprehension of criminals, suppression of fires, and treatment of patients. And whereas each dispatcher has exhibited compassion, understanding, and professionalism during the performance of their job in the past year. Now, therefore, I, Susan Seaman, on behalf of the Eureka City Council, do hereby declare the week of Sunday, April 12th through Saturday, April 18th, 2020, to be National Communications Week in Eureka, and honor the dispatchers whose diligence and professionalism keep the city and citizens safe. Thank you very much. I would like now to invite Chief Watson to say a few words if you want to about this.
No, I really wish that we weren't in the emergency posture that we are right now, and that we could have our dispatchers all present with us in council chambers, because they are an amazing group of dedicated, caring individuals, and we couldn't do what we do without them. So if they're watching at home, I just want to thank them on behalf of the men and women of the Eureka Police Department and our community for the amazing job that they do. They definitely are deserving of great recognition and honor, and we need more of them.
So, and thank you on behalf of the Eureka City Council as well. Is there anybody on council who wants to say something about this? All right. I am going to go on to the next one. Oh, shoot. There were two proclamations. Oh, here it is. Sorry, I think I went backwards. This one is for Volunteer Appreciation Month for April 2020. Whereas volunteering of one's time and resources has traditionally been and continues to be an elemental part of the essence and tradition of our country and is essential to its spirit and vitality. And whereas we are a community of people who thrive on helping each other towards the shared goal of a better life and future for all. And whereas volunteerism is increasingly recognized as an important partner in government and industry in doing the work of the nation. And whereas volunteerism is vital, fulfilling, and enriching to the participants, as well as to the recipients of the service, and should be encouraged for the benefits of all, to all the community at large. And whereas the City Council recognizes the value of Eureka's volunteers, a dedicated group of individuals who are vital to the present and future of our community. Now, therefore, I, Mayor Susan Seaman, on behalf of the Eureka City Council, do hereby declare the month of April 2020 to be Volunteer Appreciation Month in Eureka in honor of the volunteers' hard work and selfless dedication to the city of Eureka, making it a better place to live and work. Again. And I know you submitted that one as well. Chief, would you like to say a few words about your volunteers?
You know, again, just an absolutely amazing group of people. Some are retired, some work full-time in other careers, and they dedicate immense amounts of time to serve our community and the citizens of Eureka and our department. Whether it's thousands of vehicles that have been towed and abated, graffiti removed, office work that's important to our day-to-day operations, public safety bulletins and scam alerts with the elderly, and the list goes on and on. I could not be more proud of the 20 or so volunteers I know we have with our department, and I know across the city we have volunteers. And so we just thank them for their service, the true Americans, true just caring individuals who are so committed to their community that they're constantly looking for ways to give back, and they do that in a way that makes us very, very appreciative of their efforts and very proud of them, and they serve as an example for us all. So thank you.
Thank you very much. And also, this is a Volunteer Appreciation Week, so that means everybody. Miles, I'm throwing this on you, but I know you have some fabulous volunteers. Do you want to say anything?
I definitely agree with Chief Watson. We have community members that spend a significant amount of time in helping us, not only with maintenance, but also just general overall work involved with the city, whether it's volunteer projects that are making new capital improvements or whether it's maintaining existing infrastructure throughout our parks. We have a lot of volunteers as well as along the waterfront trail. The vast majority of the maintenance that goes on along the 6.3-mile trail, it's done by volunteers, and it's a very well coordinated effort. And I want to thank all of the community members that help us with that, and also the staff that coordinated our Empower Eureka program. Is been going on for a little over a year now, and it's definitely gaining more momentum and having more interest from people in the community. So we really appreciate that.
Yeah, I want to thank you for all that you guys do and getting those volunteers organized too. That's it's an effort, but it is well worth it, and it makes our community members feel like they could be part of making us all better. So I appreciate what you do, and I appreciate what they do. Anybody else have anything to add? All right, moving on. I want to add one thing to the mayor's report today, and that is next week is Week of the Young Child. And last December, we adopted the Children's Initiative. And one of the first big projects was to have a celebratory dinner next week, honoring Friends of the Young Children and people who take care of children in our community. Well, clearly we're not going to be able to have an event, but just like we're seeing with so many other essential employees, we're really recognizing now how important it is to have access to childcare so that people can get to work and help us with public safety or get to hospitals and work in grocery stores. So next week, I have partnered with several other educational and childcare organizations like Humboldt County Office of Education, Eureka City Schools, First 5 Humboldt, the California Association of Education of Young Children. And we're kind of putting together a virtual celebration. Keep your eyes open for information about that. We're just asking community leaders to sort of give some messages on online and share those, maybe decorate your windows to celebrate children and the people who take care of them. So you could find information at Eureka Honors Week of the Young Child on Facebook, and then that'll be posted on several other web pages. So just keep your eyes open for that. It's fast and furious the way information is getting out, but it will be out completely soon so that we can all celebrate Week of the Young Child next week. And moving on from that, I would like to open up for presentations. We have a presentation of the work that's being done by our CSET crew with the homeless community. So again, I'd like to invite Chief Watson and also Sergeant LaFrance to share with us what is going on there.
Thank you, Madam Mayor and members of the council. I'll briefly introduce this topic, and then Sergeant LaFrance is out there doing the work every day with his team, and our community partners will go into detail about our efforts with homelessness in the city of Eureka, particularly during the COVID crisis. We've seen some progress over this last week in our collaboration with some of our community partners, including DHHS. So that's going to be exciting to talk about that, such as screening, transportation, and lodging for the homeless. And so I'm going to go ahead and turn it over to Sergeant LaFrance. I may chime in from time to time. Thank you.
All right.
Hey, Pam, can you share my screen?
Brian Gerving will be sharing that he's operating that part,
Okay.
and I'm sure he will
Okay.
be doing it.
Let's see here. You should be able to do it, Lenny.
Let me see. There it is. Yeah, there it is.
There you go.
There we go.
All right. So thanks for having me here tonight. A little bit untraditional way of doing this, but it's good. So a lot of things going on with the homeless community. This has been my life for the past 4 weeks. It's been busy, pretty much nonstop since March 16th. So CSET and how we're addressing homelessness and COVID-19 currently. I'm going to go over four major topics. One is our concerns. We have obviously many concerns in the community. 2, the actions we're actually taking. 3, the proposed and research actions we looked at. And then challenges we're facing. Again, if I apologize if anything is misspelled, because got this together late yesterday. So some current concerns we're having up front, and then what we thought of initially, and also ongoing concerns. First off is the spread of the virus with our homeless population, going from our population to the entire community. We just finished our survey, our homeless survey of 2020, which was done over March 8th till April 4th, so a month period. We surveyed over 220 homeless individuals. So I'm going to refer to some numbers in here based on that survey. So 25% of our homeless said they recycle to support themselves. So that means that 1 out of 4 are going to recycling bins, dumpsters, whatever, reaching in, grabbing supplies. That's problematic for us, as if whatever they're touching, it's possibly going to spread virus. The research on that isn't so hot right now, as of I've researched. We still have underlying causes of mental illness and addiction. COVID-19 didn't solve our underlying causes, and they're still existent. We still have to deal with them. And with the mental illness and addiction, a lot of our folks we're seeing this don't have the ability to even think about prevention or preventive measures to actually stop the transmission and or advocate for themselves if they're feeling a certain way, if they're feeling sick. There's no real way for them to advocate for themselves. And for some, it's just not a priority. A lot of our guys that are they're suffering addiction, prevention of COVID-19 is not a priority for them. They're still going to go out. They're going to find alcohol, find drugs to get their fix. It's just not a priority right now. It's making it very, very concerning for us. Right now, more than 50% of our homeless have an underlying medical issue. And per the CDC, that's what makes them so vulnerable to and high risk to COVID-19, is their underlying health issues. So again, mental illness, we had more than 50% self-reported. So again, it's probably, the number's probably low, but self-reported is more than 50% saying they're mentally ill, or suffer from a mental illness. And then a lot, again, cannot advocate for themselves. So we have to advocate for them. And these are the folks that are not able to get in the shelter. Brian's going strong at the mission right now with his personnel. Again, a lot of the folks on the street you're seeing are the severely mentally ill. And right now, the folks on the street, again, are the severely mentally ill at free meal. Also, we'll talk about in a little bit about disturbances. We're seeing an uptick in undesirable behavior. So we're seeing a lot more fights at free meal than we have in the past year and a half. Often it's a daily occurrence, if not every other day, either a verbal or physical fight. And over the past year and a half of CSET, that's really kind of stopped happening. So we're seeing definitely some issues with that. And most appear to be mental health related. And then for right now, the option for our folks in the street, they have a telephone number they can call but for mental health crisis. But again, a lot of them, one, can't advocate for themselves. Two, they don't have phones. And so how can you call a number when you have a phone?
So just going back to Sergeant LaFrance's previous point, you know, a lot of the homeless had routines, and they were used to having services delivered in a certain timing, in a certain format. And obviously the COVID emergency has completely disrupted routines across the board, even at the city, and certainly with our service providers and community partners. And on top of that, there's an underlying tension and sense of anxiety that I think that further exasperates some of these conflicts among the homeless. And so it just is another layer of challenge that the team has worked hard to try to introduce some new routines and some stability and normality, working with our community partners, such as with the daily serving of meals at St. Vincent de Paul.
So the weather has not played nice at all, which has caused a lot of issues. Obviously, it's rain. It's cold out at nighttime. It was dropping down into the mid to low 30s last week. We had a lot of rain, and so it's concerning for us because, again, a lot of these folks have underlying health issues. So I have to ask myself, is the weather going to make them more susceptible to COVID-19 because of underlying health issues? Something we're going to ask a lot of questions in this presentation because we have a lot of things we need to know and stuff we're trying to think about and prepare for the future. Another concern is our community partners that work every single day with this population, and also our city staff. Every single day, I have our officers down at free meal and in the field. We also have Uplift down there who've been phenomenal. We have Betty's out and about doing exactly what Betty does, which is amazing work. The guys in the mission are doing great work, but again, we're concerned about their health also. Because they're susceptible as well. Example, if my entire team had to be quarantined, it would be very, very damaging to the city right now. Same if Betty's or free meal shut down. where would these guys eat at? Some things to think about. So if people go down, where are they going to get services?
Pause just 1 second there. So we've had one of our CSET officers that has been around. They were county workers, not homeless in this case, that were confirmed positive and went on a modified quarantine for close to 10 days. Is back to work with certain precautions and thankfully completely symptom free, and I think it's going to be okay. And we just received notification today of another one of our team members who did have contact with an individual that has now since been confirmed tested as COVID positive. That member, as I understand it, is a member of the homeless population in our community. Now they've been identified. I believe they're being isolated, and it's believed that our officers' risk is very, very low due to the nature of the contact, the precautions they took in place. But that just gives you an example, even at this early stage of this emerging situation, already what we're running into.
So a bunch of things we're doing right now. I'll go over some of our community partners, what we're doing with them, and also kind of some miscellaneous aspects. So again, this is really just a snapshot of what we're doing. Every single day, I feel like I'm going 100 miles an hour from 8 till 6 plus at night. And then on the weekends, we're still going because it doesn't stop on the weekends either. So one thing every single morning for about 2 hours, I talk to all of our community partners. I ask them a couple things. One, I check on their current actions, what they're doing, what their proposed actions are to address COVID, the challenges they're having, what their needs are. That's really important for us. A lot of our community partners need someone to advocate for them, and so we're the avenue currently for that. Just example, today, Betty's been trying to get gloves. Luckily, the chief was able to get her a box of gloves from us, and we were able to secure several hundred gloves from Mendy Supplies. But again, we're finding out their needs and trying to work through the barriers to get them exactly what they need. Because we also ask them to partner with us to help us address homelessness in our community. We have to take care of them also.
And these were masks.
And then, yes, masks, sorry. And also we're getting daily updates on how many guests are at the Eureka Rescue Mission and also their health status. Currently, your rescue mission, everyone's healthy, men and women's side. I think the men is around 37, 38 guests and about 70 plus overall, and the women's side is about 33 currently. And we'll talk about them in a little bit. And from day one, which I'm calling March 16th with the shutdown, I believe it was a shutdown date. We started immediately that morning talking with our partners, and it's been happening every day since. They know Betty, usually it's one ring and Betty answers now. So she knows I'm calling about 8:15 in the morning. So let's talk about St. Vincent de Paul or free meal. So based on our survey, about 79% of the homeless use free meal. It's still the #1 location for Eureka's homeless. So immediately we got the hand washing stations and porta potty down there, thanks to Miles' coordination and through City Hall. We've been working with St. Vincent's and City Hall to shut down 3rd Street. It allowed us to do social distancing. If you saw the article in the Lost Coast Outpost, it showed some of the dot system we use. It's very systematic. It makes people have 6 feet between each other in line. We hold up the line, direct them towards washing stations, and then we direct them forward. Logistically, shutting down 3rd Street was really the best option for us. There was some talk about Mercer Fraser lot, but just logistically and from security, just wasn't going to work for us. We wanted to use the street. We could be right there. Food could be delivered out of the building without taking it across the street or down the street. And for us, shutting down the street was the best way to kind of maintain order, but also implement those measures that we need right now. So really everything we're doing currently at Free Meal is really septed. When you walk into our quote unquote scene, you're contacted by somebody, said, hey, how's it going? Welcome to Free Meal. Please jump on a green dot, follow the system around to the hand washing station. You'll be directed from there. So we're having constant contacts with these folks to kind of stabilize the environment, but also make sure that we're clearly communicating exactly what we want them to do for their safety. Again, we're down there every single day with Uplift and assisting St. Vincent staff. Primarily, we were there until March 27th. And then very recently, we got home there from the county, who've been absolutely awesome with us to help us with the system down there. We did create an information board. If you come down there, you'll see it on the side of the building. We're updating the COVID numbers every day. We're information about Open Door Clinic, the number to the COVID line for the county. showers, food services available, et cetera, et cetera, et cetera. A lot of these folks, their phones are dead. There's no way to charge them. So we're trying to communicate the best we can with them and update them on information that's coming through. And usually you'll hear a briefing. I'll give a briefing over the PA system. We have a set standard we go through of lists, and we kind of update them also verbally. And they seem to appreciate it because they often ask us questions that we're going to provide for them because they've recognized it from the day before. A hot number is how many COVID cases there are today, which is always provided to them. And what's great about this, a lot of the ones that are able to, they're helping us self-police. We actually had one guy down there in a full-on gas mask directing people in line. So the rescue mission. We work with them obviously a lot. We strategize with Brian about things he wants to implement inside the mission and provide any support he wants. Ultimately, it's his facility, so it's his decisions. But again, he'll run a lot of things off of us. We have been coordinating, or we started coordinating intakes from the jail straight to the rescue mission. So if someone is in jail longer than 14 days, Brian will pick him up from the jail and drive him straight to the mission for shelter. And we are seeing an uptick in people coming out of jail onto the streets.
Let me interject there just for a minute. So this came out of another an idea or a concern or a problem presented by one of our other community partners. I believe that was Brian Olson from St. Joseph's Hospital that works with the homeless down in that area. And they ran into issues with clients that were released from jail and unable to make the handoff into the mission out of concerns of introducing the virus into a controlled environment where they're trying to protect the vulnerable. And so this is just an example of the kind of daily problem solving that takes place by having this kind of relationship with our community partners, open dialogue, offering support and asking them what are your issues and your problems, and doing our best to either meet those needs ourselves or through the Uplift program or other city resources or other community partners. And so while this is still kind of an in progress or in process solution to this one issue, it has been implemented and is working. And so that's just another example of what Sergeant LaFrance was talking about. And we knew about the problem because a community partner came to us and asked for assistance. And so that's an important part of our relationship.
So we are currently getting a daily list often from the mission. They'll choose out specific people that they have done well in the mission before and ask us to go find them and see if those folks want to go back into the shelter. So we're kind of also doing a focused approach on people that would do well in the shelter. We started coordinating intakes between the mission and DHHS, which is a good thing. So we can kind of circumvent right into the mission. We also helped the women's side yesterday with 2 females going from the mission. They had a couple issues inside the mission, but Betty took them both. And so they'll be over at Betty's for 14 days. And after 14 days, we'll be back to the mission. So again, that partnership is so key for us. When we talk to everyone in the morning, we're able to problem solve those things from one problem to a solution, which is really important. And we were initially given screening questions from Open Door, and we actually sent those over to the mission and to Betty's also. So this way, this is the very, very first week of when this started to give a general idea for the mission to kind of put them at ease to actually start doing intakes on people if they could. And then the chief provided a thermometer to the mission also. That's one need they definitely had. So Betty, again, I talked to Betty several times a day with doing intakes, support, her needs. She is serving dinner from about 3:30 to 4:30 at her day center. Betty probably has some of the best food in town, by the way. And so we helped make sure that's going to be a stable environment when people get food. But Betty does a very, very good job of stabilizing her environment, and we really appreciate her. We also are coordinating intakes to the village with DHHS Home, which is the street outreach team. We made, I think, 6 or 5 transitions from home to Betty's today with them. And then again, moving people from the mission to Betty's. Betty also got the screening questions. And then we also got our thermometer. So Open Door has been an awesome partner from the beginning. Thomas Steenblock is phenomenal to work with. He's a great guy. From the onset, I called him, I think it was on Wednesday of the week of the 16th, and said, hey, we have some issues. What kind of screening questions can we have? And he got us a general list fairly quickly so we could start doing intakes with our partners at the mission and at Betty's. And again, before anything was official, he actually made arrangements for us if we thought there's possible exposure to get that person to be seen at Open Door. That was extremely helpful. And then also he offered assistance for mental health. If we ever bring anyone in crisis down at Free Meal, we have a number that we can call into to do a video conference with them. And then they also were one of the first ones to come down to St. Vincent's and do a walkthrough as they prepared to do screenings down there. Food for People is really a new partner for me. Ann Holcomb, again, she's awesome. Worked with her on several issues. They've been having disturbances with this. People are frustrated, they're scared, and more disturbances at their food deliveries. And so we sent one of our guys down to help them out, use CEPTED, again, crime prevention through environmental design, to work through a drive-through process and a walk-up process. And they've done a really, really good job. We kind of backed away, I think last week or the week before, and they're really handling business. They're very efficient and doing a great job. We also assisted with a senior event, which took place on the 14th Street at their old facility. I think it was about 400 people went through. A drive-through also went very, very well. And then hopefully this Friday, they're gonna have an event at the Bayshore Mall, one of the parking lots there that we're working on, and we're gonna help coordinate with them also. The miscellaneous things, we've also been helping out public health. We do have information on who has possible exposures. And so if they're definitely in the homeless community or someone that we would be aware of, we're helping to locate them and then get through the correct process to make sure they're quarantined. So we did develop a high risk list of our homeless individuals that would be high risk to COVID. A lot of it was based on our data from our survey. Our survey had 35 questions, again, 220 people surveyed. We can filter out data. And so we can put high risk, 65 and older, physical disabilities, we can filter that out. And we were able to complete a pretty good couple list for the home at the county to start finding placement. And they started doing that, I believe, today, or sorry, yesterday, I think it was. They started finding people placement. We are also assisting DHHS Home with keeping people in their housing if they're failing to be cooperative with the shelter-in-place order, or if they're causing problems or possibly to lose housing. We definitely want to keep people inside and we want to keep neighbors happy. We also want to get people's compliance and not cause further issues. And then a couple, I think it was last week, I actually walked around with our MIST supervisor and our MIST clinician, and actually within about 15 minutes had 2 people housed in sheltered, either at Betty's or at the Mission, just in 15 minutes of walking around Old Town, because the need is definitely there. And then we continue to provide resource updates to DHHS for distribution. Often we have information directly from the source, Betty, the Mission, St. Vincent's, and we can directly send it over to DHHS for distribution. So we received some information about grants and resources. We sent it out to our community partners. It's constant communication. Rain. One day it's pouring pretty good, and so I went all over the city looking for ponchos. Aaron Ostrom over at Pacific Outfitters, he had some, I got what he had. And then luckily I went to the dollar store and bought out everything they had. So more than 100. We distributed them that systematically to make sure people weren't taking more than one. But again, that's a need we're probably always gonna have. But for this event, it was a major need that we had to do. And luckily we were able to scour through the city and find enough ponchos for folks. And then we also ask our members of the homeless, what are their needs? The biggest needs from us they're having that we can provide is really a phone charging station. And we've also been trying to see if we can get some kind of mobile payphone or a phone they can use to connect with loved ones. Often if these folks can connect with their family, we can often get them back with their family in shelter, which may help solve some of the issues. And then we are coordinating with Waterfront Recovery. They are doing intake still, but it's very, very limited. They have a strict screening process, obviously, which is important right now. But there is still movement with Waterfront. So even though we're dealing with COVID, the underlying issues, addiction, mental illness, we're still pushing forward with those issues. The library has been a hot topic across the board for a while. We did meet with the library director. We conference call with Connie from the county, and hopefully get some resolution there in the near future. So we really, when we're thinking about COVID, I'm trying to think long-term. Again, I don't have all the answers. I don't think anyone does. But again, these are some of the questions we've been asking ourselves. So, what are our ultimate plans if we have a major outbreak? confinement, isolation of our homeless population. What are our plans for that? And that's something we're trying to strategize on and think about, and work with our partners who hopefully are also thinking about the long term if worse gets to worse. And again, what's the process if people appear symptomatic? We have that process now in place to move them from point A to point Z. And we have numbers to call, transports are taken care of. So that process is now being taken care of. And then really preparing for the worst case scenario with our homeless. We have to think way outside the box and long term in case this goes on for a while. And we ask, go ahead, Chief.
Yeah, just to pause you for a moment. So, that the coming up with what we identified early on as we felt was a tremendous need was the issue of actively or proactively screening the homeless for symptoms of COVID. And then what do you do with them from there? How do you get them to the next step for further medical assessment, a test ordered, transportation to these, to the ER if that's where they have to go. And then finally, if the decision's made by public health, into some type of place where they can isolate safely, warm and dry, away from others, like local motels. And so that's something that DHHS and public health worked on. Pieces of that puzzle were not immediately in place, and unfortunately took a little longer than we'd like. But obviously there's a lot going on globally in the entire county, not just with our concerns in Eureka. And so we had a couple of meetings with Michelle Stevens, for instance, Connie Beck, their staff, and they got on that and came out with the screening protocol, 24/7 service available, or the number we can call where someone can provide that transportation when needed. And again, this whole process that now has been used at least a couple times in the last few days, and as I understand it, used pretty seamlessly and successfully for what it was intended to do. So those kind of community partnerships, again, and working together with Director Back and Michelle and their staff to talk openly about problems and challenges and strategize together with solutions that are workable. And so we value those relationships. We're really pleased to see this problem more or less solved at this point. I'm sure there'll be a few bugs to work out, but it's definite progress in an important area of need. And now we're hearing from from DHHS that they have some staff that's available to help train our community partners in the process of going through the screening process and connecting with this transportation and this help. And so I believe they have 3 staff members prepared to go out to either at St. Vincent de Paul, the rescue mission, Betty Chintz, or whatever, provide that hands-on training with this process. And again, Sergeant LaFrance referred to the tremendous help that Open Door has been, and I think they're actually going to be a part of this process as well, very intimately, because they are essentially the primary care physician during normal hours for the homeless. The only alternative after that is a trip to the emergency room, which is less than ideal. So again, we view this as a success in partnership with DHHS and public health and others.
So, and one thing we've also been trying to do is project, like if this happens, today's decisions are going to impact, next week's actions also and results. So we're trying to really look to the future and kind of just have a good game plan be ahead of the curve. We don't want to get behind. We want to be proactive, not reactive, but also think forward. And so even with all of this, we're still trying to maintain normal operations with CSET. We're still trying to be out there making sure that we're maintaining order. But also we want to make sure that we're also balancing outreach with folks. So it's been definitely challenging, to say the least. So it's from an administrative standpoint, we did split CSET into two separate teams. From Sunday to Wednesday, we have a missed officer and a ranger, and we have assist from 1 patrol officer. Wednesday to Saturday, we have our Old Town officer and ranger, again, assisted by patrol. And then I'm still working a Monday through Thursday schedule. However, I'm still working from home on the weekends if need be. That's just how it has to be right now, because phone calls need to happen. Some things pop up like this weekend with public health trying to find somebody. We had to coordinate that from home. It is what it is for right now. And so we're working a lot, obviously, with our Uplift, who's been absolutely awesome. Miles, thank you. Miles brought additional staff in today, and the past couple days, and they really have just grasped onto this. doing awesome work for us, and that's greatly, greatly appreciated. Sorry, I'm losing my thought real quick, but I'm going to push forward. So at St. Vincent's, we are wearing all PPE, all masks, and all gloves are required right now for everybody. Also for Uplift, we're working with Miles right now to make sure you guys have enough masks so you can be down there with us. Again, we have to have those for the safety of our crew. Also, I believe St. Vincent's is also they're also wearing masks down there now, and they've been wearing gloves since always, I think. So some proposed actions we've done. So field screening at St. Vincent's de Paul is actually implemented today. Elaine I think it's Holgan. She's the homeless services coordinator at the EOC. She is absolutely awesome. She came down there today, got this process moving within about 8 days or less, and it's working well today. They screened a lot of people down at Free Meal today. It was really good. We did propose a joint task force with the county. In theory, it'd be a combination of two teams, two-tier teams with two supervisors at the top, myself, and it would be a county DHHS supervisor running the unit. We'd have two teams. Both teams have law enforcement and social workers and outreach workers. And then we'd have one mental health clinician on also. This way we could have 7-day coverage for the entire city. And it was possible we could have extended it out into the county as well to a certain degree. And the task force is a common practice with a crisis like this, which has a sunset, which I'm hoping to sunset soon. We actually did look at doing the encampment. We saw a lot of researched it. There's a lot of things on social media right now about the encampment in Tampa. It just happens in my grad school. One of my members of my cohort is also a Tampa police sergeant, and he's in the sector where that encampment is. I actually talked to the person who runs the homeless outreach team down in Tampa. He's actually running helping to run the encampment down there, and it's not everything's being released in the news about it. It's currently costing about $120,000 a month to run for 100 people. Again, $120,000 a month for 100 people to be in an encampment. It's taking about 6 staff members 24/7. This is what he does in Tampa, and he's not a fan of doing this at all. There's major issues with social distancing. There's zoning issues, et cetera, et cetera, et cetera. I talked to him for a while today about it. His name is Dan McDonald. Again, same problematic we have here. I actually wrote out a plan preparing for kind of all our avenues. And again, from a management level, bringing services in, mental health, addiction, getting compliance, finding a location, which would be extremely problematic, and it would be very, very difficult to implement. You want to go ahead, Chief?
Yeah, I mean, you hit a lot of the bases, and we want to solve the problem that we have, and we certainly want to be open-minded enough to look at all feasible options. But so far, on our experience and our research, and even concerns expressed by the county health officer, Dr. Frankovich, and DHHS, it seems like probably an insurmountable barrier to truly get the kind of camp that would be needed, emergency camp, in place that didn't do more harm than good. Because really, even Dr. Frankovich publicly stated that the homeless right now are already self-isolating largely in smaller groups, which from a viral standpoint in the spread of disease is better than putting them in mass in one location or one or two locations where that could actually increase the spread of disease. And even no matter how well managed maybe it could be, the problem, which was discussed earlier, is such a significant portion of our homeless population has significant mental illnesses or addiction issues, and often co-occurring disorders with both. On top of that, you have a segment that just knowingly and willingly refuses to follow the rules. And so trying to ensure that proper social distancing and other safeguards are met would be a nearly impossible task, and likely would spread the disease among that population, as well as any social workers, our staff, our officers, Uplift, and other community service providers that tried to work there. So we certainly have some real concerns about how this could actually work in real life. And that doesn't discuss the financial aspects and who's going to run it and the logistics required to do so at a time when everyone is stretched thin with staffing money and other resources, just trying to manage the crisis as a whole. So that's really all I have to say on that right now. That's just kind of where we're at based on initial research. And certainly I've heard from key community partners that would need to be fully on board with this, that are basically saying it just can't happen right now. And you throw in the concerns of the county health officer, which makes a lot of sense. Those are some pretty big barriers to climb unless a plan we haven't heard yet was presented. So we just want to touch on this because I'm pretty sure this is one we're going to get asked questions about, maybe even at the end of this presentation.
All right, a couple last slides here, some challenges we're facing. So again, mental illness and addiction, it's still present. COVID-19 did not solve anything for mental illness and addiction. And it actually made things harder for us because we're trying to get preventative measures with these folks. And most are just unable to even process how to prevent this or even understand what's going on, despite information we're trying to provide for them. So again, compliance is hard to do. Some just won't self-comply with what needs to be done. And the lifestyle, the fact that they're moving about in the community, again, that potential spread, going through dumpsters or looking for recycling, which people are still doing, even though recycling has been shut down, it's still happening. It's very, very challenging because they're constantly moving about. If we do have someone that's possibly exposed, we're looking for them. Luckily, we know most of our people fairly well, know where they go. But again, if they're out and about moving, it could be 24 hours till we find them. And then after 24 hours, here we are again. There's possible more potential for spread. So reduction in services has been a major issue for us. Some people just completely left the field, others reduced services, and some are coming back now. That's been a major issue for us. One thing for us, for our folks, unfortunately, is showers. I know the showers at the library have been discontinued. So people are looking for showers. Betty's still operating Tuesdays, Thursdays, and Saturdays. But again, I'm not sure if that's going to meet the need for the folks we have currently. And then as we're with the reduction of services, how are we going to address things like addiction? So currently, I think HRC and Crossroads are not doing any intakes. I believe HRC is now full, and then Crossroads is full, I believe, and HRC is not doing intakes. So again, if underlying issues are still trying to address, how are we going to address them? So we're limited staff across the board. St. Vincent's has their 2 cooks, Bob Santelli, their board member, and then usually 2 volunteers. So 5 people preparing food for up to usually about 250 meals a day. So they're working a skeleton crew. Luckily, Uplift's providing support for that. We are also. But again, everyone's working a skeleton crew. I think Health and Human Services was reduced by about 30% as of the first week, I believe, with childcare or other things. So they took a major hit also. And then again, we had one officer for us is a 20% reduction in staffing. And so he was quarantined for a while, but luckily he's back now and back to work. Again, upticks in fights, very challenging for us. And again, most are mental health related. And we're doing the best we can do to de-escalate. But again, a lot of these folks need that really attention every day from mental health clinicians or just check-ins. And right now, it's not happening for them. And some days are great days at Free Meal. Some days are very, very challenging, to say the least. But we do love the great days, and then we move past the very challenging days. One challenge for us is exposure and stress on our personnel. They are wearing PPE, obviously. We haven't really established besides the temperature in the morning and some basic questions for our staff. Again, a lot of the other community partners aren't screening as probably as well as they should, and we probably should give some more suggestions on them to make sure they're also healthy. And then we got to make sure our people are taking care of themselves. It doesn't seem like we've had a break for about a month, but again, we've got to move past this, but also take care of ourselves while in this crisis, because it's not going to stop any time in the next couple of weeks. So we'd love to, but we got to keep pushing forward. But you just got to make sure our staff's mentally good, physically staying healthy, so we can actually keep doing the work. And we can open up the questions for you guys, and I can stop sharing the screen.
Right. And right before that, I just want to close with one or two other quick developments. One is about a week or so ago, I think it was DHHS, but the County Emergency Operations Center, through their Health and Welfare branch, added a homeless group leader. That's handled by Elaine Hogan, who Sergeant LaFrance referred to earlier. That seems to have immediately began to address a communication need and borne some real results. And so very grateful to see that. That was a great idea. Director Beck told us a week or so ago that they were implementing that, and that has been a positive thing. One other thing, and again, I don't want to misspeak for DHHS, but I know that there's been a lot of discussion, and they have put plans in place to look at who are the most vulnerable among the homeless in our community. Obviously, those that are 65 and older are part of that. Certain serious underlying morbidities or other health conditions would be another. And, that actually could grow into quite a long list beyond that. And so the home team, we heard via a meeting this morning, went out there actively with the lists that have been developed and engaged, I believe, around 50 of these most vulnerable members of the homeless community, tried to ask them some screening questions to see if they would be suitable for high needs placement in some local motel rooms that have been procured by DHHS. And of those 50, I think only 4 were even willing to talk to them. And the vast majority were uncooperative. They said they didn't want help. They didn't want to talk to staff. They refused basically to go through the process with them. And so that kind of gives you a snapshot of some of the problems that we're facing, because they had rooms potentially available to them and weren't at a place where they wanted to engage in the process, even with non-uniformed personnel. Now that could change. Sometimes you have to go to an individual experiencing homelessness 10, 15, 20 times, encouraging them, hey, are you ready now to go to waterfront recovery or to go participate in this process? In 19 to 20 times it's no, and finally that last time they say that they're ready. And so hopefully home will make more progress on that. Certainly not for lack of trying, but I applaud them for looking at that as one of these strategies to get many of the most vulnerable homeless off our streets. And so it's often said you got to meet the homeless where they're at. That's very true. And I just want to end with not only Eureka Police Department and Uplift Eureka staff and other departments within the city, are working hard on this issue, but we're also partnering closely with our community partners and other public entity service providers to try to come up with some solutions in the middle of this crisis. We haven't forgotten about the homeless. Certainly, we haven't arrived. A lot more work remains to be done. We're going to need to come up with more strategies, more problem solving, and do more than we've been able to do. But we are spending a tremendous amount of time, on this issue. Just even between Uplift and CSET's team, if there are others, many others involved in this. So with that, now we'll open it up to questions.
So if you guys raise your hand, I'll call on you if you have a question. Ask Councilmember Allison.
Hey, I just want to say thank you all, Uplift, Eureka Police, and DHHS for trying to do your best in these times. And I think it is showing that we are trying to do something. My question was, are any of you guys aware what the state of California is trying to do to address the homelessness issue? I've read about how Governor Newsom was considering putting homeless individuals in hotels and things like that. Do you know if that's starting to transpire at all?
I know that the funding that's been allocated for that, and I've heard the number, the city manager may want to chime in on this as well, but I think $600,000 possibly that could be available locally. But that's all funneled through the county. It doesn't come to the city. And so that's an important thing to consider. And then I just gave an example of some of the challenges they had with trying to place some of the homeless population in our local motels. Plus, you have to find a motel willing to take on that challenge and the risk associated. There's stories across the country where there have been property damage, and we'd want to make sure that we can make that right. We have, they need to be able to stay in the room, especially if they're isolating. And many of them, that's very difficult to do where they're unwilling. You don't want them to invite 10 of their friends in there. That's another problem that cities across the country have experienced, because now there's no social isolation and you have the associated problems. So it's not a perfect solution, but certainly if ultimately together in partnership we could source enough motel rooms for those that would be I guess, suitable for placement in there and high needs. If we could lower the numbers on the street, that's still a win. I don't have any more information beyond that right now, other than that some rooms have been procured or sourced by DHHS and public health for when homeless members need to be isolated or quarantined based on symptoms or a positive test. And also some limited number of rooms, I don't know how many yet, for the most vulnerable among the homeless that are high needs for getting placed in a safer place, as was discussed previously.
Got it. Well, thank you for keep trying to do what you can with the best resources we got. Appreciate that.
Councilmember Messner.
Thank you. I just wanted to say thank you for the report, and thank you so much for all you guys are doing. I know this is a very challenging time and it just adds to your workload. I really appreciate what you guys have done. And I think it's important that the city sees also the work you guys are doing so that the questions that they might have are answered. So I appreciate your guys' report and just letting our city understand how hard we're working to help all our populations in our city to overcome this and to overcome any challenges they might be facing. Thank you again.
Any other questions or comments? Councilmember Burgell.
Mute.
There you go.
Okay. So I just have a few questions. One of those questions is we're talking about vulnerable populations. Are there families out on the street right now, kids that we're aware of? I know that there are some, housed in different motels and that type of thing. But do we know if there's actively kids living outside right now?
Not that I have seen for quite a while. Some of the kids we had coming to Free Meal were from the Mission, but that was really before COVID hit. So in the past even year and a half that I've been with CSAR, a little bit longer, we haven't seen a whole lot of family with kids out and about. Those usually get swept up pretty quickly to the Mission or other shelter through child welfare.
Wonderful. Okay. And then is SOS, are they still coming down to St. Vincent de Paul? Is the van, because I know with the road closure, are they still able to come down and check in?
So SOS is home. They just changed the names. I'm not sure what home stands for now.
Okay.
But they no longer, I don't think they don't use the van anymore, but they have been there for about the past week and a half, maybe longer, helping us out at Free Meal. I mean, they're an invaluable partner with us, really, really good people, dedicated, very caring, work well with us. So they are down there every day.
Okay, great. Well, I just, I'm just so grateful and thankful for all you guys are doing. Sitting at home, it feels really powerless. And so it's great to hear that there is so much happening and so much good things happening with our population. And I really too appreciate this idea. I talked to Brian today about the coordinating with the jail. That's a really, I really appreciate that too, because gosh, we don't need more people added to the streets. It's just not helpful. So yeah, I guess. Oh, one last thing about the phone charging station. Do we have any ideas about what that would look like? Or are we just still in the beginning infant stages of that?
We thought of a couple ideas. I thought the library initially said they're going to put one out there, but I think they kind of went back on that idea because it would be unmanaged. One idea we had is get a power cord from Free Meal, throw it out during the street closure at a strategic place, and people could charge their phones there. But again, the problem we could have is one, if it's not a controlled environment, one, people could steal phones. Two, if everyone's touching everyone's phones, it's not good either. So those are really the challenges we have with it. But again, it's not, we just eventually need to figure out an idea for it.
Okay. Well, again, I just want to reiterate that I'm really grateful and thankful for all you guys are doing and the partners. And I really appreciate you putting yourselves out there every single day. It's certainly most excellent. Thank you.
Councilmember Castellano, I saw your hand up.
Thank you. And yeah, thank you so much for the very detailed report. I appreciate the breadth and depth of what's happening. I think basic question I have is that joint task force you talked about that would combine public health, social workers, law enforcement. I mean, it seems like that's starting to come together. Is that something that I guess I'm personally excited about that idea? Is that something that seems like it's going to happen, or would be sort of the next step if there's enough support for it?
You know, the MIST program, which has been around for a number of years now, is a smaller version almost of that, because we are putting trained officers together with mental health staff like case workers and clinicians on a much smaller scale. But this is envisioned to be broader scaled, 7 days a week coverage. And I think logistically, what we're hearing from DHHS right now is, you know, again, they're struggling with 30% reduction of staff and other needs, not just in Eureka, but across the county, and aren't quite prepared to go to that level of organization. But things are evolving rapidly. Who knows what tomorrow or the next week will bring? Right now, what I'm seeing, and Sergeant LaFrance could chime in, is certainly a higher degree of presence on the streets, partnering with our staff and our community partners again. And, you know, our teams are working together. I think we were just looking at what else can we try to do. The task force concept can be effective at really becoming a force multiplier and creating more focus and economy of action together, and they can be effective. There's a way to make it work. So we have the plans, and it is scalable, and we do communicate with DHHS regularly. Maybe we can ultimately implement some kind of hybrid model, but really, again, we also understand, as much as we'd love to see it, they have their challenges, their needs as well, and so we'll see. And I'll throw in one thing that's on the end of your question, but just, we are very aware of council's concerns about the homeless, all of you. City Manager Lauder has been very good about communicating this. He receives daily reports and two-way communication on the homeless issue. I think it's clear it's an issue of high importance to him as well. And so we're having those conversations every day, and your concerns are definitely being communicated through City Manager Lauder to us, and he's working with us to try to address these questions and these concerns, as well as Director Slattery, Director Gerving, and some others in the city.
Thank you.
All right. Councilmember Arroyo, do you have anything?
How'd you know? I just wanted to see if there's the possibility to reinvigorate our efforts to use the trailers. I've gotten a couple of calls about that, and since this is pertaining to homeless folks, and that would be perhaps immediate housing for people, could someone speak to that and what we might see moving forward?
City Manager Lauder, please.
Thank you, Madam Mayor. Members of the council, just to Councilmember Arroyo's point, staff has considered moving forward with this project, especially in light of the governor's directives regarding housing and, of course, the pandemic, the COVID-19 pandemic. After a robust discussion about it, it's staff's recommendation that we continue to work with the Coastal Commission through their process. Even if we were to move forward with just placing the trailers, say starting tomorrow, maybe Director Gerving could speak to the logistics of doing that. It would take quite a while to properly place the trailers and make sure the infrastructure is in place. And so it's possible we could be months out if we just started doing that already. And by then COVID-19 might be past. And then what we're left with is a more compromised relationship with a state agency that we need to be able to work with going forward into the future. So it's our recommendations, my recommendation to you at this time, that we don't just go ahead and start placing those trailers, but continue to respond to the Coastal Commission's requests for more information. As you're aware, we did submit our application to them. They did respond with, I believe it's a 9-page letter requesting further information, and staff has been trying to follow up with that to make sure that they will ultimately review that application and act on that application. And I will be sending that letter out to all of you tomorrow so that you'll be able to see the Coastal Commission correspondence with staff for yourself. Thank you, Mayor.
Thank you. Did you want to add anything, Director Gerving?
Thank you, Madam Mayor. What the city manager said was accurate. I think best case scenario, if we were to move forward today with commencing everything that we need to get construction done there, we'd be at least 3 months out from having the trailers placed and ready for the Betty Quan Chin Homeless Foundation to do their improvements to the interior of those buildings, which really can't happen until they're in place, unless there's a lot of coordination ahead of time. And then the PG&E service is also a timing issue. We would have to really try and lean hard on PG&E to speed up what would otherwise be probably a 12-month process to get power in place. So it does seem like the construction timeline makes the COVID-19 emergency justification a little bit weaker.
Did you have any other questions, Member Arroyo?
Not at this time. Thank you. Thanks for the thorough update, all of you.
So I also would love to thank you guys for all the work that you put into that. I understand putting together reports on top of doing your job feels like a lot of work, but it's very helpful for our community to understand really how much you guys are doing so that they can appreciate it like we do. Also, I had one question. You've mentioned recycling several times. That is the primary way a lot of folks get their money. And now they're closed, which is good because maybe they're not rifling through as much, but also bad because they don't have any way to get money. So how is that working?
I agree. That's definitely an issue we have because if people are recycling to get money to feed their addiction, then obviously the addiction hasn't gone away still. So they're getting money otherwise. So I'm not sure. Honestly, I've been really out of the loop for the crime stats. The chief could answer on that. I'm not sure if it's trending upwards for thefts because my focus has really been on more the social work side of COVID and homelessness.
I do know that the 2 periods for calls for service that we've checked, the actual citizens reports of crime and incidences where they're requesting an officer, so that would include reportable theft, has remained flat. I believe there is a slight uptick on some burglaries, such as commercial burglaries, though we are spending a tremendous amount of time proactively conducting business security checks at night, often over 100 a night. And so trying to reduce those risks. So I'm not real clear yet on any changes to the theft rates specifically associated with the homeless and the lack of or the loss of recycling as an income. And I don't know that we would even be able to extrapolate those kind of statistics directly. But you throw in loss of income from recycling and then look at panhandling, it's just like there seems to be a little bit less of that happening. And I'm sure people are rightfully concerned about conducting essentially hand-to-hand transactions because that is the perfect way to spread the virus in our community. So panhandling is actually risky. And so if people are scaling back on how much money they give to the homeless, that is another source of income, clearly, for at least some of them. So those issues are going on. At the same time, well, one could assume that maybe there's an uptick in some of this petty theft. And you look at how businesses are now operating, often with greeters at the door, controlling access, limited numbers of people coming in, social distancing, that does make those stores less conducive to theft. So it'll be interesting to look at this in the rearview mirror in a few months and kind of look at the answers to some of these great questions.
Thank you. And Councilmember Castellano has one more thing.
I was thinking a little bit about the screening that you've talked about, where you're trying to reach people who are houseless and high potentially high risk for COVID-19. And I believe Council Member Allison referred to Project Room Key, which is that's kind of that program. I'm curious if maybe a different kind of marketing might help, like maybe some large posters in places that people frequent, basically saying like, you know, if you're over 65, have a chronic health condition, you know, and list them or whatever, you could qualify for a hotel room, you know, during this period, because that's my understanding of the program. I mean, of course, we'd want to check with DHHS about that, but do you think that a different kind of marketing for that might help get people into a safer situation?
I'm not 100% sure on that. It could be worth a try, but again, I think it's going to be what DHS wants to do on that front. We are getting a lot of lists to them of our folks in the streets that we believe are high risk. Some subjective, some objective factors involved. But again, it's really going to be on them. Could it work? It could. If you got one person inside, is it worth it? To me, yeah, it is. And we definitely could implement that if we needed to. Often for some things, not saying for this in specific, but during our briefings down at Free Meal, we do announce, hey, if you do want to go to the mission, please come see us. If you're interested in going to Betty's, please come see us, and we'll explain the process to them also.
All right. Thank you very much, guys. That was an awesome presentation. And I think at this point, I will move on to the next item on our agenda, which is the public comment period. So City Clerk Powell, did we have any phone calls we were making?
Yes, Mayor, we do, and I will be calling them right now, and they will have the usual 3 minutes.
Hello.
Hello, this is Pam Pell, City Clerk, and I'm calling you to make a public comment this time during open public comment.
Yeah, awesome.
Okay.
Very well. Hi, council and staff. My name's Aisha. First, I want to thank you all for your responsiveness regarding my request to have public comments during meetings. As we're witnessing right now, you all worked really quickly to make it happen. I imagine it's been pretty stressful to make the transition to a virtual meeting. So extra thank yous for taking this extra step to help the public participate in these meetings. Secondly, during last week's meeting on 30th, city manager letter and council had agreed to hold what I believe to be a private meeting on April 1st. And my understanding from listening to Monday meeting is that the intention of Wednesday meeting was to share additional information related and questions that arose on Monday. So the meeting last Wednesday wasn't public, but my understanding is that it should have been none of the topics qualified for closed session or sunshine laws or otherwise exempt from open session in light of the governor's recent order. There are a few suspensions described in the order, but none of them seem to justify the Wednesday. So I just wanted to emphasize the importance of sharing information during these public meetings, unless it's legally necessary to hold closed session under sunshine laws or the recent executive order. So I'm not sure what what came of that meeting last Wednesday, but that was just my understanding. So I wanted to bring that point up. I also say this knowing you are working really hard to keep these meetings transparent. I appreciate efforts by council and staff to ensure the safety and well-being of our community during this emergency, including your thoughtful amendments to the eviction moratorium. And just underscore what all you just said, really appreciated. I know a lot of members of this community appreciate the presentation CSAC gave. And yeah, congrats to the city and the grant funding they received to assist the houseless in our community. And I see that they're applying for more. So just a big thank you for all your efforts on that.
All righty. Is that everything?
Thank you very much. Do we have any additional
And
calls?
Mayor, that is the only request we had.
All right, thank you very much. So then moving on, we are going to go to public hearings. And our first public hearing, our first item is a public hearing. A summary vacation of City of Eureka non-exclusive easement. And we have Inflow and Infiltration Manager Gabriel Adame here to make that presentation.
Hello, Madam Mayor, council members. Thank you, everybody. Let me go ahead and share my screen. We're here to talk about the summary vacation of an easement that was created over at the county courthouse. There we go. In 2016, when the county performed a subdivision of a parcel over there, there was an easement that was inadvertently created for the city. So in 1994, the city council vacated an alley that traversed the county of Humboldt's parcel property. Then in 2016, the county of Humboldt subdivided this property into 2 parcels. In the process, they inadvertently created an easement which was dedicated to the city of Eureka. The city would like to rectify the situation by requesting a vacation of the easement. This is parcel map 3620 showing the creation of the 24-foot wide non-exclusive easement to the benefit of the city of Eureka for public use. The summary vacation procedure, the City of Eureka's policies and procedures file 4.02 regarding the vacation of city street, alley, or easement. Section 3, summary easement vacation, allows the city to summarily vacate a city easement if the date of the dedication or acquisition is less than 5 years old and more than 1 year immediately preceding the proposed vacation, and the easement was not used continuously since that date. All of these points have been met. The effects of the vacation of the easements will not affect any private property owner, the public, or a public utility. Parcel A has always been and continues to be used as a parking lot for county employees. Additionally, the language of the dedicated easement was too broad. It's believed the original intent was a non-exclusive ingress, egress, and public utility easement for the benefit of future development of the 2 parcels. Vacating this easement will reduce the liability to the city of Eureka. Public utilities in the area. There is an abandoned sewer main in this area, but it's no longer used by the city. The new sewer main exits onto 4th Street. The sewer there is in the easement is no longer in use. There are no water utilities, and there are also no storm drain facilities in this location. We reached out to the franchise utilities and notified them of the easement vacation, and no objections were returned. It is our recommendation that we determine the easement to be surplus and determine that vacating the easement will have a cost-neutral benefit to the city, and to order the vacation of easement by adopting a resolution of the Council of the City of Eureka ordering the vacation of that easement located between 4th and 5th Streets and J&K Streets, reserved by parcel map number 3620 in Book 36 of Parcel Maps, page 69, filed in the Office of Humboldt County Recorder. Thank you for your time.
All right. Thank you for your report. And if you could unshare your screen and I can see everybody, I will ask if anybody has any questions. And I'm going to just start with Councilmember Castellano. Oh, I saw you, Natalie. Okay. Oh, do you?
I don't have any questions. It was pretty clear to me.
Thank you. Councilmember Arroyo, I saw your hand went up.
Okay, I'm going to try to look at the screen, not the screen that has my agenda. So I got a couple of questions about this topic. I'm not sure that it was clear to people that this is where the courthouse and jail is. Is that correct?
Currently, it's the parking lot to the
Oh,
north.
yes, that's.
Yeah. Mhm.
But that's where the expansion is planned.
I'm not sure of the future plans for the county. I believe so, but I'm not positive of that.
Okay. Okay. I think the folks that reached out to me were interested to know if the city could charge the county for this. Could you speak to that?
Well, we felt that this was in the benefit of the city as well as the county, and so that's why we decided to go for the summary vacation of the easement, as opposed to the additional hoops and fees that would be required for the county to vacate.
Okay. Thank you. Yeah, these just were comments that came up today, so I didn't get a chance to run them by anyone. So thank you for clarifying.
Mhm.
Councilmember Burgell, did you have any questions? Councilmember Mesner? Councilmember Allison? All right. City Clerk Powell, do we have any calls or on this issue? If I remember right, we do not have any calls, but have any calls?
Sorry, I need to remember to unmute. Yes, you are correct. We did not have any calls or comment for this item.
All righty. So with no public comment, I will bring it back for comments or a motion. And if you want to raise your hand, if you want to make the motion or have a question, just do it. Councilmember Mesner.
Make the motion to go ahead and determine the easement between 4th and 5th and J and K streets to be surplus, and determine that vacating the easement will have a cost neutral benefit. Is that what I'm supposed to be reading? Just making sure. Okay. To the city, and adopt a resolution of the City Council of Eureka ordering the vacation of that easement.
That was it. Do I have a second?
I'll second.
Oh, Councilmember Burgell had to set her hand up quickly.
Oh, okay. You can second it.
So I will ask then for a vote. City Clerk Powell, would you like to do a roll call vote?
Yes, Councilmember Castellano.
Aye.
Councilmember Mesner.
Aye.
Councilmember Arroyo.
Aye.
Councilmember Allison.
Yes.
Councilmember Burgell.
Yes.
Motion unanimous yes vote. Motion carries.
Thank you very much. That was a piece of just regular, normal city business. It's kind of nice. Now we are going to move on to the next item on the agenda, which is the consent calendar. I do believe we had one item B2, that was going to be pulled from consent. Other than that, can I have a motion to approve the rest of it? Or,
I'll make the motion to approve.
Natalie had her hand up first. I'm gonna let Natalie do it. Okay.
Okay. I move the balance of the consent calendar minus item B2.
All righty. A second?
Second.
And Councilmember Mesner. All right. All in favor, if we could do a roll call vote?
Councilmember Castellano.
Aye.
Councilmember Mesner.
Aye.
Councilmember Arroyo.
Aye.
Councilmember Allison.
Yes.
Councilmember Burgell.
Yes.
Unanimous yes vote. Motion carries.
All right. So now we're going to take a look at item B2, which is road maintenance and rehabilitation account for the fiscal year 2021. And I do believe Director Gerbing is going to address that item.
Yes, Madam Mayor. Thank you and good evening. council members, I'm going to share my screen here. I can get to the correct one. There we go. So we are here to talk about the road maintenance and rehabilitation account for this upcoming fiscal year. We're going to cover a little bit about what the RMRA is, how much funding the city has in the upcoming fiscal year, what it can be used for, also kind of helping to paint the full picture here. What is STIP funding? And I'll get into what STIP stands for. What can it be used for? And then what and when are all of the upcoming planned projects? So a little bit of background on the RMRA. It was signed into law in 2017 as Senate Bill 1 or SB 1, but the name for that account where the funds are accrued and dispersed is the Road Maintenance and Rehabilitation account. So that new funding source for road maintenance came from increases in fuel tax and vehicle registration fees. And at the time, and still, this was a huge shift for the city and all jurisdictions throughout California, including the state itself, really tremendously improved our street maintenance funding. We're still nowhere where we need to be in the ballpark of $3 million annually, but you'll see that this did give us a significant amount more than we had before. Every city and county receives a share based on a formula of road miles and population. It's sort of a balance between the two. And then every agency has to make a resolution each year accepting the funds and designating the projects that are proposed to be conducted. And then this money is strictly for street maintenance and rehabilitation, no new construction or anything like that. So it's about fixing potholes and putting new pavement on failed streets. So what are we looking at for this coming fiscal year in the city of Eureka? And this is what was in the agenda summary, and I'll get into a little bit of the rest of the picture, as I mentioned. We're planning on doing pavement maintenance on 14th Street between M and Broadway. That's a significant chunk of heavily traveled street. That project is in the initial design phase, and the current elements include replacing failed asphalt as well as striping along the roadway and in crosswalks. And then this is anticipated to use up the $513,000 that the city is projected to receive from the state and the RMRA for this coming fiscal year. And the project would be constructed next spring or summer. So the rest of the picture, as I mentioned, is the State Transportation Improvement Program, commonly referred to as STIP. Those are also state funds. They're administered through Caltrans, but a different funding source and a different way that they're programmed. It's been around for well over a decade, and the city was awarded STIP funds way back in approximately 2008, but that coincided with the Great Recession, and state budget cuts resulted in those funds ultimately not being delivered. So key in on that 2008 date, because that's going to be important as we go forward. Finally, in 2009, after the STIP was canceled and reinstated, and the city and HCOG advocated really heavily to get those funds back to Eureka where they had been previously programmed, last year, the city was reauthorized. And those funds, though, haven't been delivered yet. We anticipate getting them probably late this summer or early fall. And at that point, we can program them for construction next construction season because the timing just wouldn't be right to use them this fall. And it is a significant chunk of money, $1.3 million that was awarded for this coming fiscal year. But as I said, that project money has been sitting there for quite some time, or the projects associated with that money have been sitting there for quite some time. And this is what I want to key in on. The following street sections were approved for STIP funding. You have 14th Street between West and M, and if you'll recall, the RMRA funding was for M to Broadway. So put together, the combination of STIP and RMRA will allow the city to pave and rehabilitate 14th Street all the way from West to Broadway. Additionally, the STIP funding is programmed for Highland between Broadway and Utah, another street that's a frequent source of complaints and has a good amount of traffic. And then Hawthorne and Felt streets in the area of the transfer station, very heavily traveled, not just the number of vehicles, but also the nature of the vehicles going to the recycling center and the transfer station. And then Coster Street between Del Norte and Washington Street. So the important thing here is that this is one-time funding for the listed streets only. So if the city were to have, through some miracle, paved these streets without the STIP funding, then we wouldn't have been able to use the STIP funding for other street maintenance projects. We would have lost out on that portion. So that's why these streets have been sitting in the condition that they are since prior to 2008. We identified those streets as candidates for this funding that long ago, and so they were already degraded at that time, and they've only continued to degrade in the intervening years. One important thing to note is that we can't do this again. The current STIP guidelines, which have been amended since we were awarded these funds back in 2008, do not allow for maintenance projects. So we're lucky to be able to use these funds for this purpose because we don't have that chance again. Just looking at a few shots of what we're talking about here, we've got 14th Street in the area of S and west of E, along with Hawthorne and Felt near the transfer station, Highland Avenue, and there was a map here that didn't show up when I went into presentation mode. So let me see if I can get it back. So the map here shows what I was talking about. Highlighted in red is what staff proposes to pave using the RMRA funds in fiscal year 2021. And then highlighted in green are the other street segments that staff proposes to pave next construction season with the funding from the STIP that was awarded quite some time ago. So that wraps it up. You have staff's recommendation in the agenda summary. And if you have any questions, I'd be happy to answer them.
Do we have any, Councilmember Castellano and then Burgell?
Just a quick question. So you said this more about the STIP funds. They no longer allow for maintenance. What will they allow for in the future?
That's a good question. I don't have the current guidelines available to me, but I assume they would be more transportation improvement, maybe capacity enhancing projects.
Thank you.
Councilmember Burgell?
Hi, thanks for your presentation. I was curious when I read the summary. I just wanted to bring forward, so you explained 14th Street, so thank you for that. But there are streets that are in dire need of some TLC, and I'm thinking primarily now of streets again over like by Target, like R Street, that kind of area where you need a 4-wheel drive to get through there. I mean, you've been down there. And I'm curious if some of these funds couldn't be used to, I know it's too expensive to do the whole street paved, but is there a way that we could remove current pavement so at least they had some sort of flat road as opposed to the way that it is now? Because it said that the funds weren't specific to that particular job, right?
Right. The RMRA funds, the city can designate each year which projects we propose to complete. Reverting paved streets to gravel is something that's relatively untested in a built-out urban environment. I realize that Humboldt County as a whole is not what one would consider urban compared to a major metropolitan area, but still, city streets with utilities and sidewalks and things of that nature, reverting them to gravel is untested. And I think we would have issues not just with utilities and manholes, valve boxes, things like that, but also accessibility under the ADA at crosswalks, as well as the fact that gravel isn't maintenance free by any stretch of the imagination. And while those streets are not in good condition, I'll be the first to admit that, and the first to lament it. If we could pave them, we absolutely would. But gravel would require grading and compacting probably several times per year in order to keep the streets drivable. So I wouldn't recommend that. I don't think any of our staff would. However, like I said, if we could pave them, we would. It's just a matter of, under the current funding environment, we simply don't have enough money to maintain the streets as we need to. We have roughly, 1/6 of the money that we need to adequately maintain our streets. And until we have more, the fact of the matter is that the city has to dedicate its limited dollars to rehabilitating and maintaining the streets that are more heavily traveled. So that's the unfortunate answer for lightly traveled but really poor condition streets.
Well, that's very unfortunate considering the business owners that have their businesses there that do a great job in our city and are important. It's rough when your clients or your customers have to drive down a bouncy road. And so that's why, I was curious. And I don't know, is a gravel street, I understand the maintenance and all of that, but I mean, better for vehicles, would a gravel street be better for vehicles than bouncing around so much? And is that something to consider in the long run? These are just questions I'm throwing out there. I've gotten calls from business owners in that area plenty of times about the bounciness of the road and what we might be able to do differently for them. So I just want to put that out there.
Yeah, thank you. And there, we have looked for creative ways to do something of a Band-Aid fix. We met with contractors to see if there is another method of doing a lower level rehabilitation, but basically the answer came back that it would be wasted money. It might last a year or two, but really those streets need a more robust reconstruction that we just can't provide right now.
Okay. And how much is it per block to reconstruct a street like that? Just curious if you know.
The estimate that we came up with, and this was a few years ago, so it could be slightly different now, but the estimate that we came up with then was that at the time we had about $200,000 worth of project funding annually. And that's since been augmented by the RMRA, which is great. But that $200,000 could either pave, a significant chunk of a street like 6th or 7th with a grind and overlay or like a grind and patch job and then a slurry seal, or it could pave one block of a street that needs a more comprehensive reconstruction. So it really is a lot of money to get at these more heavily damaged streets.
Great. Thank you, Brian. Or Director Gerving, thank you.
All right, do we have any other questions from council? All right, then City Clerk Powell, did we have any public comment on this item?
No, Mayor Seaman, no one has requested to comment.
All right, so I will bring it back for a motion or comments. Anybody want to make a motion? Oh, Councilmember Castellano, thank you.
I have a quick comment. First, I'm really excited that 14th Street is is part of this RMRA rehabilitation and maintenance plan. A lot of people use that street, and it really cuts through kind of a more working class part of Eureka. And I think that, I just know many people who will deeply appreciate this maintenance project. So I'm excited that it's in the works. And with that being said, I move to adopt a resolution of the City Council of Eureka designating projects to be funded by the Road Maintenance and Rehabilitation Account, RMRA, during fiscal year 2019-2020.
All right, do I have a second?
I'll second.
Councilmember Arroyo.
May I make an additional comment?
Yes, you may.
I did recently because I'm a transportation nerd, I guess, I did look at the 2020 STIP guidelines that the California Transportation Commission passed on like the 25th or 26th of this month. And there's just a lot of, to the question around like future guidelines, it really just seems like the emphasis in the future and the priority will be given to projects that build climate preparedness and reduce greenhouse gas emissions. And that seems to be the focus. So I'm sure there's a lot more detail than that. It's a very, very substantial document. But if that kind of gives an idea of where the funding opportunities might be in the future, that's really what I noticed about it.
Thank you. So we have a motion, we have a second, we had a little discussion. Does anybody else have anything to add to that? If not, City Clerk Powell, would you mind taking a roll? Oh.
Yes, Councilmember Castellano,
Aye.
Councilmember Messner,
Aye.
Councilmember Arroyo,
Aye.
Councilmember Allison,
Yes.
Councilmember Burgell.
Yes.
Unanimous yes vote, motion carries.
All right. So we will move on to item C1, Bill number 980 CS, Urgency Ordinance Limiting Evictions Amendment, and City Attorney Robert Black will provide a report. So may I have a report, please?
I do. Thank you, Mayor. This item was on your agenda, or this subject was on your agenda before, and there is an existing city ordinance because it was passed on March 30th as an urgency ordinance. This repeals and replaces that urgency ordinance. And so if this, for any reason, does not pass tonight, the March 30 ordinance would remain in effect. You might recall that the governor issued an original executive order on March 16 dealing with the subject of evictions and people whose tenancy was troubled due to COVID-19. That ordinance basically said local jurisdictions have the power to legislate in this area and to provide protections for tenants. Then on March 27, perhaps because cities and counties were slow to react, perhaps because some indicated they wouldn't provide protections, he issued a statewide set of protections, but did not lift or replace or retract the local government authority to do more and to offer additional protections in this area. So your March 27 ordinance did extend protections, for example, to commercial tenancies. It required landlords to inform tenants of their rights under the ordinance. It provided tenants whose non-payment of rent was related to COVID-19 with additional time up to 6 months to make up the rent payments that they couldn't make within the protected period. And perhaps I'll linger there for a moment because I do want to emphasize that the only months that come under the protection of the ordinance, just like with the governor's executive order, are the months of April and May 2020. And that would remain so in the absence of any further action by your council. So it really extends from April 1 to May 31. The 6-month period in question is the period in which tenants who were unable to pay the rent and could establish that their inability was through or because of the protected reasons, generally COVID related, that are part of the ordinance. It provides them with 6 months to make up those 2 months rent if they took advantage of both months. One of the things that this ordinance does that was kind of a loophole in the March 30 ordinance that you adopted, is the 6-month was just a blank. There wasn't any requirement that tenants do anything before the 180th day, or really, I guess it would be the 182nd day. They wouldn't have to do anything. They wouldn't have to make any payments. And so the landlord would be at risk of non-payment of those 2 months rent for the entire 182-day period. So this ordinance that we're bringing before you tonight does provide for a payment schedule in which 1/6 of the unpaid rent would be due every 30 days during the 180-day period. So 30, 90, 120, 30, 60, excuse me, 90, 120, 150th day, and the 180th day, there would be a requirement that a payment be made. If the tenant and landlord agree otherwise, or agree on a different schedule, agree, for example, that no payments have to be made, but all the rent will be paid on the 90th day, they could agree to that. There's just a default schedule if they don't agree. It's a little more burdensome for the tenant, but a little less jeopardy for landlords. So those, in terms of the differences between the March 30 ordinance and the present ordinance that is before you, we make clear that this is an uncodified ordinance, which is a matter of significance because it won't be put into the Eureka Municipal Code. We make clear that these protections are in addition to the protections under the governor's order. That would be significant if there was a challenge to this ordinance and some part of it was disabled. It also is made clear that the March 30 ordinance is being repealed and replaced. But as I said, if, for example, that doesn't happen, the March 30 ordinance continues in effect. The original ordinance, there was discussion of late fees and whether or not late fees should be negated for the 2 rent payments, the April 1 and the May 1 rent payments. On closer reading, that was mentioned in the March 30 ordinance, so that was actually already accomplished. But this revised ordinance adds interest on the missed payments. That would also be eliminated if the tenant complies with the terms of the ordinance. Yeah, and it makes clear that there would not be a gap between the protections of March 30 and the protections of this bill. So with that, and I also wanted to mention one thing that I think we discussed a little bit on March 30, but maybe was not clear enough. This ordinance is an ordinance intended to be put forward as a shield by tenants in court. The city does not have a direct role. We don't provide hearing officers. We don't provide advocacy for the tenant, but the ordinance itself would be basically brought to the court's attention and interpreted by the court without direct involvement of the city in the court proceedings. And I think that is something that we have sought to avoid, and it would be, I think, wise for the economy of the city's time, effort, and money to keep staff out of the courtroom. And so this is intended to be a tool. I think having benefits to tenants who have been adversely afflicted by COVID-19, and by afflicted, I mean both economically and potentially health-wise. So if you have any questions, I would like to answer those. Mayor, I'm not hearing you. Mayor, I can see that you're talking.
There.
There you go.
I thought I clicked it and it hadn't undone.
All right.
That's why nobody had questions, because they didn't hear me ask. Do I have any questions? And I'll just do a roll call and ask. So Councilmember Burgell. No, all righty. Councilmember Castellano.
No questions.
Thank you very much. Councilmember Messner. All right. Councilmember Arroyo.
No questions. Thank you.
Councilmember Allison. All right. See none. City Clerk Powell, do we have any public comment on this item?
Yes, Mayor, we do have a gentleman, Gregory Holtz, who wishes to comment, and I will be dialing now.
All righty.
Greg Holtz.
Hello, Mr. Holtz. This is City Clerk Pam Powell, and you are now, if you can provide public comment, you have 3 minutes.
Thank you. I'd like to use my time to express support for the city's actions, both tonight and possibly in the future, as City Attorney Black alluded to protect tenants. And to address some information that is floating around. There has been more action on this front by the state. The Judicial Council issued new rules, emergency rules, yesterday. Those rules, in addition to the executive orders by the governor, do not save tenancy. I want to be very clear about that. They delay evictions. They change the timelines of the process. They don't give tenants a substantive defense that they can use in court. The result is going to be a wave of evictions once the crisis is over, churning the rental market, wrecking credit histories. The city's ordinance allows tenants to save their tenancies. It allows tenants can pay to make it up and stay. It still allows landlords to remove tenants on a normal timeline when there are problems created by tenants, and the judicial also allow that. And it still allows tenant or landlords to remove tenants who don't pay within those 180 days. There's been concern expressed for mortgage holders, understandably. Under the CARES Act, 70% of single-family mortgage holders, single-family home mortgage holders are covered because they're federally backed loans. And those provisions include 180 days forbearance with an additional 180 days upon request from the borrower. And that's with no interest and no fees. And so we want to express support for the amendment to prohibit interest that tracks the CARES Act and commend the city taking this important step to support the health, safety, and stability of our community. Thank you.
Thank you very much.
Thank you.
Do we have any additional calls, City Clerk Powell?
That is the only one we have.
All right. So I will bring it back for comment or a motion. Do you want to raise your hand if you want to make a comment? start video because host has stopped it.
I'm working on that one by one here.
So Austin is good. No, oh, has asked you to start your video. Thank you very much.
Trying to do the or see the light on the.
Is the meeting being
No,
recorded? Is the meeting being recorded yet?
Is it being recorded by
Yes.
both Zoom and yeah?
Yes, it is.
Okay, thanks.
Okay.
Yeah.
Okay.
Mayor.
Yes, ma'am. Yes.
Hi.
Councilmember Mesner, would you like to repeat what you said?
Yeah, I was thinking maybe I should repeat what I said.
Let me first just reiterate too that we do have a first and we have a second. The first was Councilman Castellano and the second was Brigel. And then we had discussion and you had a discussion comment.
Yes.
Okay.
All right. So I wanted to just mention, and I'm actually repeating this because the video stopped for the public's sake, that I really appreciate City Attorney Black's intentionality about ensuring that we balance everyone within the city, property owners as well as renters, and that we're looking at all of it together. That the 180 days was a lot of concern for particularly property owners and landlords, and that because HUD has not stopped their payments for landowners. And so it was a concern that I had as well, just making sure that we keep the economy afloat and that we don't end up with foreclosures all over our city, that we are people who are looking out for every citizen within our city. And it's something that we're tasked for and with. So in regard to that, because that's an issue and has been an issue, we went ahead and made sure that, first of all, City Attorney explained that those 2 months in the beginning, the April and May months of non-rental payment, is specifically following the governor's order. And it doesn't delay for 180 days the payment of those 2 months. It only gives those 2 months relief. And then the next 6 months, there's a payment schedule to be paying off those other 2 months. And so wanted to really commend the attorney for clarifying that and for making sure to take those landowners into consideration also in the midst of this, and also just to make sure that we as a city are working together to help one another, and that this is also just intended for those who, due to COVID-19, specifically loss of employment and or because they have contracted it. There's a list of things that those are really the only renters who would be requesting this, rather than just every renter. So just wanted to clarify all of that and appreciate our attorney making sure that we have not only followed the governor's orders, but are really looking at how we can support everyone in our city.
I have also been talking about this a lot, and there's a lot of education involved to remind people that once that 2 months is over, not just for the sake of the landlords, but also for the sake of the tenant, remember that you have to pay that back. So if you can pay your rent, if you're allowed to make partial payments, do what you can so that you don't have to start worrying about this after the crisis is over. But this allows people to have time to catch a breath and figure out how it is that they're going to be able to address these needs. And they're not just cut off at the end of 2 months like some others. So, all right, we have a motion. We have a second. Can we please have a roll call vote? City Clerk Powell.
Already, Councilmember Castellano,
Aye.
Councilmember Messner,
Aye.
Councilmember Arroyo,
Aye.
Councilmember Allison,
Yes.
Councilmember Burgell.
Aye.
Unanimous yes vote, motion carries.
All right, thank you very much. And we are now going to move on to our reports and action items. So I will ask City Manager Lauder if he has anything for the City Manager report.
Madam Mayor, members of the council, yeah, just a couple of things that I'd like to emphasize and maybe just get the message out there. I'm sure that maybe you'll touch, Madam Mayor, on the fact that you're doing a series of PSA announcements. Those are being posted on our website along with press releases and other kind of communication efforts to talk to the community about COVID-19. We've tried to put a variety of resources on our city webpage, and in some cases, of course, linking with other organizations that are already doing a lot to provide information and support, whether that be to residents or businesses in this time of responding to the COVID-19 pandemic. Maybe a few things that we're doing as city staff just for the public's benefit. We moved several weeks ago to an appointment-only basis at City Hall for very limited transactions. We've been doing that for quite some time. We've adjusted shift working employees so that they are in smaller crews, traveling in separate vehicles to work sites and trying to maintain their social distancing to the greatest extent possible. For staff who have either demonstrated a need or just for social distancing throughout the organization that can be deployed to work at home, we've done that, and our IT staff has really helped and stepped up to making sure that people can be deployed at home and still be productive members of the staff and still servicing or providing services to the community, just in a very, very different format. While I've stayed at home maybe a day and a half total, I've gone back to City Hall the entire time. Just simply because I feel like we have staff that are going to have to be there no matter what. And I think it's important that they see the city manager showing up for work at that location as well. But we are also maintaining our social distancing as much as we possibly can in the offices on third, second, and first floor. We are now starting to get more PPE, personal protective equipment, N95 masks in particular, gloves, things like that, to our emergency and first responders. We've been trying to communicate or increase our communication with the county who may be involved in helping to house homeless folks that might be either symptomatic or under suspicion of being exposed potentially. And hopefully, if we are already getting service to those individuals by one particular agency, that agency then is communicating with all of the other affected agencies, so that in the event a 911 call comes in, those staff are showing up already prepared with their PPE. And in a lot of instances, they automatically do that if for any reason they have a belief that there could be an exposure of some kind. So we're doing a lot of different things to try to make sure that we have a continuum of service going on to the community. Our wastewater services, our water services are also services that are oftentimes somewhat overlooked or taken for granted, but they are obviously very, very important that we continue a continuity of service for those types of things as well, and as well as certain kinds of transactions with the city. So that's one thing I just wanted to touch base on real quick. The other thing I'd like to maybe just briefly speak about is that on your consent agenda tonight, the council did approve my decision to appoint Rob Dumichel as acting director of the Development Services Department. And I appreciate that support very much. I just want to emphasize this is an acting appointment at this time. It's not a final decision. Rob is very well aware that the decision could be made for any particular reason to go to an open search type situation to make a final decision. But I have to say that in my short time as city manager, I've been impressed with Mr. Dumichel. He sought me out on numerous occasions to understand what it means to be a director level position. He's asked for guidance. He's asked a lot about philosophy, management style, expectations. He's proactively done this, and it really drew my attention to him. But what you might not know about him are just a couple of things. So he is well credentialed with graduate work, bachelor's degree, and actually a few associate's degrees as well. But Rob kind of had a life before his life in Eureka, and so a little bit about him in that respect. Um, he does have a record of honorable military service, and so I think it's important for us to acknowledge and recognize his service to our country. But I want to read something about his background here, just to share a bit with you about his background. Rob had completed the Defense Language Institute's Korean Basic Course at the Presidio of Monterey, California, and Electronic Warfare Signals Intelligence Analyst course at the Goodfellow Air Force Base in Texas. He has held the Department of Defense, the Department of Defense has recognized his proficiencies in Korean, Swedish, Norwegian, Danish, as well as giving him a top secret SCI clearance. He's also received a certificate in public engagement for local government from Pepperdine University. And he also has quite a bit of experience working with the city in a couple of different capacities as well. But he in between his military service and coming to Eureka, he also had the opportunity to be an entrepreneur for two different kinds of businesses. And one of those businesses, he was, I believe his title was vice president for about 7 years. So he's got quite an impressive background, not just serving our country, not just working in the private sector, but also working in the public sector. And I believe we're lucky to have Rob on our team, no matter what position he may have served in or is serving in now. And I just wanted to share that with you. And I really want to welcome him to the leadership team and look forward to getting to know him better. I need you to unmute, Mayor.
I know. I saw that. I said that was very nice. Thank you.
You're very welcome.
And I will move on then to council reports, and we will start with Council Member Allison.
Hi there, thank you. I just wanted to get attention from City Council and get the nod to direct staff to bring the evaluation. Sorry, I just wanted to bring to staff to be on the next upcoming agenda for April 21st. The evaluation of our city attorney, city clerk, and city manager. We've sort of put this off for some time. I know, for instance, we haven't evaluated our city attorney in almost 2 years. So I just thought it'd be time to sort of start working on that and see if there's anything we can communicate with staff, because I know we haven't done this evaluation in a long time. So. Oh, Kim wants to say something.
Well, I don't know that we should have a discussion about this, because I don't think we're supposed to have a discussion about it, but
I think she's just trying to nod yes.
okay. I will take that under advisement, and we'll talk about that at another meeting. So is that your report?
Yeah, I was just hoping to put that on for the April 21st meeting, just to get that going.
I don't know if let me think about that. And we're kind of in the middle of a crisis right now. It seems like this is a strange time to do this. So let me think. I don't know. I don't know that I'm on this. So.
All right, I'm done.
Councilmember Arroyo, do you have a report?
Not much. I left my house twice in the last 2 weeks to go to Food for People and volunteer. So that's been a good experience. I've just been volunteering to fill food bags and help support the staff there. I know a lot of folks have expressed interest in volunteering there, and they're slowly vetting volunteers and kind of figuring out how they can work in that space with the most effective number of people. So if folks are interested in supporting that organization, it seems like the best thing you could do right now would be to give them money to help with all of the efforts that they're undertaking. But I have been really enjoying getting to know the staff and volunteering there, and I'll continue doing that on a weekly basis. Beyond that, everything's crossed out on my list, pretty much all of the activities that I would have been otherwise doing. And the Humboldt Transit Authority meeting for this month was canceled, but there weren't any agenda items that urgently needed to be handled. So if folks are following that organization and those meetings, then know that the March meeting was canceled, and April is to be determined. And that's all I've got.
Thank you. How about Councilmember Bergel next?
Thank you. I just have a couple of things. The first thing is I just want to thank our community. I appreciate that people are really taking this seriously, sheltering in place, wearing masks now, which is super important, social distancing. Hopefully you're washing your hands, all of those things that are necessary. And I'm hopeful that friends that you're getting out there and getting some exercise, and that is something you can do alone or social distance. I've done it both ways, and currently alone seems to work better for me in the moment, but it's just so important, especially with the weather being what it is. We've got beautiful trails we can hang out at, the McKay track. There's just so much, the beaches. Just when you're doing that, be mindful of the people around you. That's pretty huge. And then secondly, I would like to advocate for the evaluations to be on the calendar soon. It feels like we haven't had one from our city attorney ever. Pam, I don't believe you've had one for 2 years. It seems like we do them every year, and we somehow were remiss in getting them done. And then Dean, you are almost at 90 days, close to 90 days. So it just seems like little over. It just seems like the timing, I understand that there's a pandemic, but this I think is definitely something that we need to consider strongly, because it's important for our staff and to know what's happening. So, okay, I understand there's a lot going on. But
I don't think
it might be a good distraction. Pardon me?
I'm okay with thinking about it, but I'm not ready right now to commit it to putting it on the next agenda.
Okay, but just know, I think that we need to do it sooner than later.
Have to bring it up and then give us a little time to little time to think about it. I know I personally don't have time to spend on an evaluation right now, because I also have a lot of stuff going on. So, okay, Councilmember Castellano.
Okay, thank you, Madam Mayor. I have been primarily working from home. I did, I guess in the last couple of weeks, I helped create with the Ink People a program for artists to receive support. And I also created a online fundraiser campaign, fundraiser for St. Vincent de Paul free meal. So I've been trying to use what resources I can via the internet to support people who really are on the front lines and or people who are experiencing challenges. So, and the Humboldt Waste Management Authority will be meeting this Thursday virtually via Zoom. So I will be attending that meeting. I would be, in terms of evaluations, I think I would want to learn more about how that process would work, since that has not happened since I've been on council. So maybe we can receive some information just about that process. Yeah, that's all for now.
Thank you. Council Member Messner.
Hi, thank you. Well, first I wanted to say congratulations to Rob on his new position. And also thank you to all the businesses, the public, the first responders, the health workers, all those in the city of Eureka, just for your work in keeping everyone safe by following the safety measures. And I really think we can overcome this together. I want to echo the encouragement of Councilmember Vergel to get out and exercise and be outside. It's really important for our mental health. That's a huge issue, particularly in times like this. And so I'm really encouraging people to do what you need to keep your mental health up. There are so many different ways we can help each other now, as well as a couple council members mentioned different ways that they're doing things, and there are Food for People and Betty Chin and the mission, and there's so many different ways to reach out, and those are listed. I have some on my website, also lists of ways to do that. While this is an unusual time, we are continuing to do the work, and so I think people, members of the public, just understand that as a city, there's a lot of people working to still do what is necessary for our city, as well as just the regular work we do. But during this, it's actually added a lot of work for many people. I was actually supposed to be in Anaheim this past week for League of California Cities committee meetings. And instead of being in Anaheim, we were doing Zoom meetings. And so we did those this last week. So I chair the Community Services Committee for the League. And during that meeting, we focused on issues in our city directly related to COVID-19 specifically, in cities across our state. Also, the homeless issue, the Chief and Sergeant LaFrance discussed earlier, is one all cities across California that are working to manage. And so I really appreciate the update on all we're doing as a city. We're also working on at least a dozen bills right now, specific to children, childcare, youth programs, disaster preparedness, community resilience, parks. So there's just a lot of things on the agenda and what we're doing right now. So I'm also on the Public Safety Committee for the League, and for that committee, we actually did make a decision regarding AB 2598 on law enforcement joint terrorism task force. We did take an opposed position on that bill. We're still watching for some of the other bills regarding firearms and code enforcement officer safety standards. There's just a number of bills we're looking at right now as well. But the next meeting for our committees are June 4th and 5th in South San Francisco. And at this point, we hope to be able to meet once again in person. But no matter what, we will work out ways to continue to do business during this crisis. I again just want to express how thankful I am for the ways our city has taken action quickly. Our country has faced war, disease, 9/11, and we're going to prevail through this crisis together. So thank you, everyone.
Okay, Councilmember Castellano first, and then Councilmember Vergel.
Yeah, sorry, I forgot. I wanted to speak to, well, firstly, yeah, congratulations to Mr. Dumichel, and thank you, City Manager Lauder, for sharing some of that information. It was very interesting to learn more about kind of the breadth of knowledge he brings to the city. And one thing that's come up I also attended the League of California Cities meetings virtually. But one thing that's come up at the state level is Governor Newsom has proposed that businesses withhold their sales tax over the next year. And And that needs to be approved by the state legislature. And I just want to express my deep concern about that in terms of the cities really are the kind of the front line I think as the public can see in terms of like city response to disaster or to immediate need for the public, and most all of our general fund and operating budget comes from that sales tax. And I just can't imagine the problems the great difficulty we would be in without money to use to address citizens' needs. So I would advocate for writing a letter to Senator McGuire if folks are at all interested in that. And for members of the public and business owners to also kind of stand up and say, like, we want our cities to thrive because those are the places we live in. So I just wanted to thank you for giving me the time for that.
Thank you. We need consensus on the letter, but I'm for it. Anybody?
Yes.
Okay.
Yeah, I think that's really important.
All right. Councilmember.
So I just forgot one thing, if I could.
Yeah,
Okay.
no, I'm calling on you next.
Oh, good. Thank you. So I just wanted to let folks know too that I'm attending the city county meetings Tuesdays and Thursdays at 2:30, and every Tuesday and Thursday at about 3 or 3:30 on my Facebook page. I do kind of a list of what was talked about, so you can kind of get what's up-to-date information. So you can always find that there. I've also been, I have a text list. So if there are people that want to be texted, I can add you, just let me know.
Thank you.
Thank you.
All right. City Clerk Powell, if you wouldn't mind just sending us information on the sort of the process and what the evaluation schedule is, that would be helpful. So we can explore that before putting it on the agenda.
Yes, Mayor. Normally we would put it in closed session and the council can develop their own process, and I can share with you the process that was done 2 years ago.
Thank you. That would be helpful. Because like Leslie, I've never done it before either. So, and with that, I believe everybody had a chance to report, right? So I will adjourn the meeting. Thank you all.
Thanks, everyone.
Thank you. Congrats, Rob.
Have a good night.
Good night, everyone.
Thank you.